We will be getting started in 1 minute.
Welcome everybody to this afternoon session, and we welcome everybody virtually, and participation is much expected and excited to have everybody here. Today's afternoon session is called COVID, Congress, and U.S. Foreign Assistance. What went down and what still needs to be done. This is going to be a great discussion that we are hosting, and we have some great experts from the field to talk about some of the policy, what Congress is doing, what they are still doing, what's still being debated currently in the halls of Congress, and what are the impacts to U.S. foreign aid and some of the work around the world. I do want to introduce myself. My name is Dain Hansen with the IAPMO group. We are one of the session sponsors today. And IAPMO is about a 100-year-old trade association focusing on water and sanitation around the world, focusing mostly on governance issues, standardization, codes implementation, and also product testing and certification to make sure the products going into these systems around the world are tested, certified for compliance, for safety, and reliability, to make sure people aren't getting sick, to make sure that we are, and we do this in a myriad of areas. We do this around the world, in developing countries, and we also do it right here in the United States. You know, our codes and products and services are used throughout the world. And we look forward to continuing the partnership with many organizations in this room today and at the conference, because what we've always found is that it's important to provide people water and sanitation, but it's also important to make sure that it is done in a system where it's safe, it's reliable, and it actually is going to be a sustainable approach for them in the years to come. So we're really excited for this opportunity and for this session today. We're hoping that this drives a lot of dialogue and a lot of questions, and we're excited to be able to engage everybody. To that point, in the chat box for Pathable, we encourage everybody to type in your questions and also take a poll. There's a poll here in this Google form on the slide in front of you. And I attempted to post it into the Pathable chat, and I've also posted it into the Zoom chat here simply because to make sure everyone has access to it. So we will, if you can fill that out so we know who's here and also how we can stay in touch with you. So we can keep you on our email lists or updates on what's happening in Congress and what's happening with the foreign aid assistance. So we're excited to move this forward. And again, if you have any questions, we're going to hold all the questions for the most part to the very end of the session after everyone has had a chance to speak. And so with that, we will begin the session, and I will start by introducing each one of the speakers. So first off, we have John Sparks. John Sparks has been the Director of Advocacy at the Millennium Water Alliance for more than 10 years. Before that, he had more than 30 years experience as a lobbyist for national organizations advocating for for campaign finance reform, Wall Street reform, human rights, and regulatory reform, and had served as press secretary for 2 members of Congress, staff member in several presidential and congressional campaigns, and a newspaper reporter. Next, we will hear from Liz Marcey. She is the Director of Policy and Advocacy at WaterAid America. She has more than a decade of experience leading advocacy on Capitol Hill in international development funding and policy, and she has worked for numerous organizations, including CARE and the Bill and Melinda Gates Foundation. Lastly, we will hear from Christopher Lindsay, who serves as Senior Director of Government Relations at the IAPMO Group. Christopher's experience includes serving in the White House, as well as working for corporate and family foundations. An advocate for smart and sustainable advancement of clean water and sanitation, Christopher has assisted government ministries in Asia, Middle East, and in Africa improve their WASH governance. So with that, we'll turn the time over to John to start off this discussion.
Okay. All right. Thank you, Dain. Appreciate it. Those of you who went to the last couple of years, we've had this session at lunchtime, and we've had a packed house every time, and now we have even more people, thanks to the fact we're not in a physical room. For those of you who've done this with us before at UNC, you will hear some of this stuff. You've heard some of this before, but we do have to do a little bit of introductory stuff because there'll be a lot of people participating who are not maybe that familiar with what we do, what it's all about, what we mean about when we talk about advocacy, what we're aiming to do. So a little bit of, I want to set a little context, and we'll get into the real meat of it, which is what's going on in Congress and what's happened the last year or so and what we think might happen after this. So first of all, just a brief overview by what we mean by advocacy for WASH, who is doing it, and what is permissible for you to do. Basically, I think there's this slide here. You say if you're a U.S. citizen, you can advocate to your members of Congress. And some people have this misconception that if they're with a 501c3, it is a nonprofit organization where most of them are 501c3s, that they can't lobby. That's just flat out not true. You can advocate on policy, including appropriations for federal programs, anytime. You just can't have your organization. This is where sometimes the confusion comes in. You cannot have your organization participating in the election campaign. You cannot have your organization endorse or appear to endorse a candidate or party in an election. You just have to stay out of what is obvious campaign politics, but feel free to speak to candidates about your issues. As an individual citizen, of course, you can do whatever you want. And I'll just close with a little personal note on this slide. I've been doing this for quite a while with different issues and different kinds of sectors and organizations. This sector spends less on advocacy, yet it gets so much more out of it than any other sector or interest group issue area that I've ever worked on, period. So next slide. There we go. Great. Thank you. So basically, this is just a snapshot of where we've been in appropriations by Congress for water, international water, sanitation, and hygiene. Under federal law, that's programming at USAID that is done under the provisions of the 2005 Senator Paul Simon Water for the Poor Act, and all as amended by the 2014 Senator Paul Simon Water for the World Act. Basically, USAID reports each year that it actually spends more than the amount that Congress allocates. These numbers here are from 2014 to 2020. This is the same chart I had last year. We just haven't updated it. But basically, 2020, not proposed, that was enacted. We did get 450 million, and we are basically waiting for the final on 2021, which is going to be 450 as well. So we've done quite well. This is really, in terms of the way Congress works on appropriations, for a sector our size to have grown this much over the last several years is pretty darn good, especially when some other sectors stayed level or even got reduced. A few others got increases too, but not a whole lot. So we've done pretty well. When I began 10 years ago, that was closer, the allocation in 2010 was closer to 300 million. So we've gone to 450 million. We expect in the future to get more. We are getting close into the ballpark of $500 million for funding for Congress for international water, sanitation, and hygiene. Next slide. All right, so this is just a snapshot comparison of some of the sectors that are funding different funding accounts through USAID over the several years. If you can see it, I assume everybody can see what I'm seeing. At the very far right, a little red circle around it, that shows water. It's called Water in All Accounts. And that covers a few years, several years worth, starting in 2010 and going up to 2019. The little individual bars show what was allocated each year. And if you look at that in comparison to some of the other sectors, the big one to the left is PEPFAR, which is by far and away the biggest one. But you can see that actually water is smaller than many other accounts on this particular page, but it's also larger than some. And some examples, if you can't read them, like over on the left, there's maternal and child health, polio, family planning, and all accounts. Very small is nutrition. And then we just go on through various global health accounts, malaria, neglected tropical diseases, a number of others. This chart we created at MWA a few years ago is actually 2 pages in length, but I'm just showing this 1 page here for some quick comparison. So you have just a general picture of where we are vis-a-vis some of the other, not all of the other accounts or spending areas at USAID and foreign assistance. Next slide. And last thing I want to say here is it's that basically we've done pretty well. Our advocacy covers a lot of different things. Before we get to Liz here, I jumped the slide too fast. Sorry about that. We see 3 broad areas of advocacy, those of us who work on the advocacy. We see global advocacy, we see in-country advocacy, and U.S. policy advocacy. And of course, in other countries, advocacy happens and needs to happen more by local NGOs and others to advocate in donor countries for continued support for WASH in their assistance programs, and in host countries for a stronger commitment by their governments to supporting WASH. We think that's gotten a lot better over the years, but there's a long way to go to get governments really on track to meet the SDGs. Our group, the group that works on policy advocacy, mostly with Congress, but also some other areas, we'll focus on, our group in our session today focuses on US advocacy, but this should be of interest to others as well. The United States is the largest single donor in WASH. In addition to the nearly $500 million the US government is now spending each year on international WASH, there are hundreds of millions invested in it as well by private citizens, US development and humanitarian NGOs, and other US groups every year. So the US WASH Coalition, very broadly defined, now has about 30 or so organizations that regularly check in on what's happening. Some of those frequently join with a smaller core group of us in communicating to members of Congress and to their own NGO members and donors about legislation and what's going on with WASH at USAID and also at CDC, Centers for Disease Control. Now, just to be clear, government relations is only one of the functions at each of these organizations, but any other organization can participate. So I want to turn it over to Liz because we are interested in getting to what happened in the last year with COVID funding at USAID and where we are in USAID appropriations. Liz.
Thank you, John. And it's a pleasure to be here. This is actually my first USAID conference, and hopefully one day I will be able to do that in person with all of you. Just quickly, WaterAid, if you're not familiar with us, and the three hand, as we affectionately call it, we work in over 30 countries, and we focus on clean water, decent toilets, and good sanitation for everyone everywhere. And that is the representation of the 3 fingers. So we work across the WASH sector, not just in water, but we'll be focusing today, as John mentioned, on the political state of play and kind of recent actions from Congress. Next slide. Thanks. So I was asked to speak a little bit about the current state of play with international WASH investments from the US government, where we are, how we got here, and what potentially could be going forward. So no small task. I find that when we are talking about US legislation and particularly US funding and budgeting process, because it's a very scintillating topic, it is extremely helpful to have a little bit of a coordinate check, if you will, a north and south. And so that's what I wanted to provide in this slide. You can see on your right-hand side that you've got the entire federal budget and a visual representation, and you'll note that all of foreign assistance, so all of the things that John put in his last slide, his last chart, is in that tiny, tiny little sliver, and that is roughly 1% of the US federal budget. So it's a very small amount that goes to foreign assistance, and it's a smaller amount that's a piece of that goes to WASH. That's the one piece I wanted to pass on. The other I wanted to pass on is there are kind of 2 distinctions that we look at when we look at the type of funding. One is regular funding, And that is what we call through the fiscal year. So we just started FY21 in October, beginning of October. And what's important to know about that regular funding is that it has limits. There are statutory caps. And so it is not just you can fund until we want to fund. There are actual deals in place and legislation in place binding how much money can go overall to the budget. And then that sets up a bit of a fight. The other piece is this emergency supplemental appropriations. And that is what we're using as a country to respond to COVID. There are no funding limits when it's emergency designated. And so you'll see as we continue how those spending caps, those limitations come into play around WASH and international response. Next slide. Right. So what has the US government done to respond to COVID? I think if you're based in the US, you've probably heard a lot of frustration in the news around what has or has not been done. And to be very clear, the congressional action and legislative action that was undertaken by the US government all happened in March. And it is now the end of October. So in early March, we had the first kind of immediate response. It was very small. Additional funding of 8.5 billion. I know the B sounds quite big, but that's very, very small. About 14% of that first package did go to foreign assistance, and we'll come back to that. The second response package was massive, and it had no international or foreign assistance funding in it. It was entirely domestically focused. And then the third piece that came at the end of March is probably the one that people hear about the most in the news, and that's the CARES Act. That is actually the largest stimulus package ever in US history, larger than any package under the New Deal and the Great Depression, to give you an idea of its size. And in that, about 1.12 billion went to foreign assistance issues. So 0.05% of that last package went to international response. And since March, we've seen other proposals, various number of proposals coming from Congress, but there has not been political will or negotiation advancement for any additional package to push forward. And being as close as we are to the election, it's highly unlikely that we will see anything until at least after November or later. Next slide. So what was in the funding packages? What did we do for international WASH in those pieces, and where are we currently? So I mentioned that those three funding packages were absolutely massive. And of the total three, we got about $2.37 billion that went to international funding for foreign assistance. A very, very small amount of that has been spent on international WASH response. 0.16% of that funding was spent on international WASH response. USAID used some of their regular funds, the ones that they had from the regular process that are not emergency and not subject to, they have ability to transfer the money around. We'll just leave it at that. They used that funding as a little bit of a tie-over while Congress was working through their supplemental bills. So an additional $119 million went towards WASH. There is a catch to that though. So not only do you see here this very small amount of funding, even within the international space that went to WASH, but the vast majority of that funding went to pre-existing humanitarian crisis contexts. And what I mean by that are refugee and IDP camps and areas of extreme migration. So areas where we are as a country, the US is leading, for example, the Rohingya response in Bangladesh, refugee response from Venezuela and Colombia. So we are not seeing necessarily large investments from the US government towards WASH in non-pre-existing emergencies. So if you were in the development side, you didn't necessarily see it. You can go on to the next slide. So sometimes people ask, like, why did that happen? Why is there so little? There was intent from Congress, generally when we're talking emergencies, to give a lot of flexibility, because for the administration to respond, things can change very, very, very quickly. And that is extremely true for a pandemic. And so there wasn't a specificity on what the money had to be spent on. It is important, I want to just say that in the response thus far, the vast majority of that international foreign assistance funding went towards evacuation of USAID missions and embassies, State Department embassies, PPE for our State Department employees who are still on the ground, even some coverage in terms of budget because of reduced travel income from citizens where they would pay for visas. And then a lot of it went towards response, and response under this administration has been very centralized. And the response piece focused on distribution of ventilators. So not necessarily WASH, and food security even came later. And so we are really, as a community, at a precipice here. We have been put up against what I think an unprecedented crisis in the history of WASH funding for the US government, international WASH funding. And so it has challenged us, and we are meeting that challenge by putting forward advocacy that's very integrated, includes requests for global health, for global development, and humanitarian responses for WASH. As a community, we looked at 920 million, which is a big ask for the WASH community. That was an ask as of July. And frankly, that needs to be reassessed at this point, but that gives you a sense of how long we've kind of been chipping away at this, and how little action, sadly, there has been on the legislative side. And I think the parting response I want to give to you, we have gotten very little in terms of investment thus far. That doesn't mean it can't be done, but there has to be negotiation over broader packages for us to be able to receive more. And the more that we have to wait, the more the time passes, the more the needs grow. And we know that WASH has a critical role here. So I think I'm going to leave it there, and I'm going to pass it over to Chris.
Thank you, Liz. It is great to be here with my colleagues, Dain, Liz, and John, and I appreciate each of you for tuning into our session today. As John made the point in his comments, you have an important role to play, and we hope to be a resource for you in not only keeping you up to date on what's going on in the halls of Congress and with the administration, but also your voice certainly weighs in how we can influence these policies, hopefully for the better. And to Liz's point, as Liz reiterated, funding is going to be central, to the point of our discussion. But for my presentation, I wanted to take a few minutes and also kind of highlight some challenges that we're facing domestically, and some of our other kind of WASH policies here in the United States. And we know that there's a number of you who are working, focused just on international, but also that some of you do also work here in the US too. And we face some unique challenges. There on the slide, you see two reports that have recently come out. The first one, Closing the Water Access Gap in the United States, put out by the US Water Alliance and Dig Deep. Another one, Flushed and Forgotten, from Columbia University. And then certainly just media, the article there comes from the New York Times, that draws attention to the water and sanitation challenges that we're facing here in the United States. Certainly, COVID has helped to put a spotlight on the crisis that we're facing. In fact, our colleagues from WaterAid did a wonderful survey where they found that 24% of low-income Americans reported having difficulty washing their hands at home. To put this into context, this is a higher percentage than in South Africa, which reported that 22% of low-income reported difficulty. 21% of those polled in the United States lacked availability of soap, and as one of the reasons for less frequent hand washing. 30% cited a lack of availability of hand sanitizer. And what's interesting is that 10% of those making an income between $60,000 and $69,000 a year reported difficulty in hand washing. Said one of the difficulties they faced in hand washing was just getting access to clean water, and because of it's too expensive. So we have some very unique challenges. I wanted to draw a couple points from the two reports, because I think it also shows some of the parallels that we have here in the US and also addressing WASH in the international context. Certainly, there's a difference between, the reports found that there's a difference between those who have access to centralized water and wastewater services. Many of those who lack basic access, and don't even have access to centralized systems are not even an option, are found in rural communities. We often find that this inequity is racialized, and it's been hitting communities of color the hardest. And it's no it's, of course, to many, it's not a surprise given kind of a century of neglect for many of these communities. We also face some unique situations where, older systems, may have access to water, but they don't have access to wastewater, leading to open, straight pipes kind of scenarios. Certainly that's kind of made a lot of, news here in the US. As kind of been mentioned before in the COVID situation, just as in any part of the world, lack of access to basic water and sanitation is indeed a public health crisis. As we look at US policy and how US policy's gone about addressing this, we often find that unless you're connected to a centralized system, those who aren't are largely on their own. It's the homeowner's responsibility to provide their own water and wastewater services. And certainly we see a data gap. Up until about the early 1990s, these questions about water and sanitation were asked in the US Census, and those questions were largely removed. We're starting to see a little bit of an impulse now to get that information and data collection back on track and getting it back included into the census, which we are certainly supportive of. So how does this translates into WASH? And I really want to focus in on three core areas. First, dealing with basic access and financing. Two, getting into the affordability issue, and then three, getting into water quality itself. From the data that we do have available, we do know that over about 2 million Americans lack access to water and sanitation. Put that into context in certainly how we defined WASH is maybe slightly different in the US and then higher income countries than other places. 630,000 households lack complete plumbing facilities, which for us means they're missing either a toilet, a tub or shower, or running water, or a combination thereof. Of course, as I mentioned before, this is reflects a century of neglect. And while there are programs at some US federal agencies like at USDA, EPA, HHS, they've been traditionally narrow in scope and they had very limited resources. And so they're part of our WASH policy is to draw attention to the crisis that we're facing here in the US, and then also to be a better advocate for the expansion and better resources for those programs. And then the second part of that goes to the current health pandemic that we're facing, and being able to provide immediate aid to communities without water access to be able to better cope with the COVID crisis. Certainly we saw it was well publicized in the US news regarding the situation on the Navajo Nation, where water access has been historically a struggle. The second piece related to affordability is really a two-sided coin. First off, we on the one side, we have those in urban environments who may have access to centralized systems, but as you can see from the chart on the right of the slide, the cost of water and sanitation and wastewater services in the US have continued to go up as the needs for capitalization and replacing aging infrastructure continues to increase. And so we're increasingly seeing that urban dwellers or those with access to centralized systems are being priced out of these services. And how do we being able to advocate for policies to better meet those needs as well. We were excited when CDC here in the US issued a temporary halt to residential evictions, to prevent the further spread of COVID back in September. And there's been a lot of push by House Democrats to be able to increase that emergency halt on water shutoffs. Again, these are just examples of policies that we support. And then regardless of whether you're on a centralized or a decentralized system and what those services look like, increasingly we're facing water quality issues. And so how do we begin to address either from the source water itself, whether it be contaminated from things like chromium or PFAS, or from problems that arise within the system, whether it be lead or Legionella and so forth. So how do we, regardless of the context, whether it be a decentralized or even a centralized options, how do we protect the water quality for those that are most vulnerable in our community? Now, part of the reason we want to bring this up is, for a couple things, a couple reasons. One is, we certainly want to prioritize WASH issues in its various forms across the US government in its response, both internationally and domestically. And certainly your voice can help us do that. Two, we realize that there's new funds that could be available for WASH issues across some of these non-traditional departments and offices. I'll give you a couple examples of that. First off, with USAID, industry is very excited. There's new funds that have become available through the Office of Trade and Regulatory Reform, an unlikely WASH target, where new projects are coming online in Indonesia, in India, and Philippines, and Jordan, and in Africa, addressing WASH governance through this. And again, this is a new source of funding to address WASH-related issues. On CDC's efforts, we're excited to continue to advocate for things like WASH in healthcare facilities, WASH water quality issues, even things like wastewater surveillance, disease surveillance, which they have a number of pilot projects on. The trade agencies, whether it be USTDA, USTR, or Department of Commerce, particularly as the U.S. interacts with these and on trade promotion issues, they become vehicles for us to address, WASH governance. I think there's great resources out there that through our advocacy, we can help to draw more attention to WASH related issues and to expand the portfolios of even agencies like, the Millennium Challenge Corporation to address more WASH better in their programs. Third point I want to make is that, we really want to mobilize those who are interested in, WASH issues to be a voice, not only on international WASH issues, but also on US domestic issues too, and be able to speak kind of with one voice and authority on this. And then the last point I would like to make is just, from our perspective, we can see that there can definitely be a cross-pollination and lesson learned, both how we address WASH in the international context and also how we're experiencing it here in the US and other high-income countries. Some of these are hard lessons to be learned, whether it be, lead in our pipes, making sure that countries that are putting in new infrastructure learn from the US lessons and to avoid those, contaminations of their systems, to also innovations. We're seeing examples of innovative models that could be used both here in the US and also internationally, and being able to create a platform for those types of innovations and community solutions to be shared and then brought to scale. So we're excited to be able to present kind of this different aspect of some of the WASH policy priorities. And with that, I will turn it back over to John.
Okay, John has to make sure that he's ready. There we go. Okay, thank you, Chris. It's very helpful, and we worked very closely with IAPMO the last several years. And I just want to say, as someone who spent a lot of time over the years going into a lot of offices on Capitol Hill, Republican and Democrat, House and Senate over many years on different issues, it's great working with IAPMO because they bring an angle and a perspective to this that a lot of NGOs can't really bring. Nonprofits bring a white hat into the room, to use an old expression, when a lot of members of Congress who don't know much about international water, sanitation, hygiene, they think we're the good guys. But it's great to have the private sector also involved, working with us very closely and with USAID to support USAID. And IAPMO is a great partner in that. I just want to follow up on a few things here, and then we're going to go back to Liz for a few minutes and get our way to some good question and answer session, we hope. Following up on how USAID is implementing the 2005 Water for the Poor Act and 2014 Water for the World Act, those are things that we spend time on as well. It's not just about appropriations. Appropriations is something that never stops. As soon as one appropriation cycle is finished, we start right on the other one. It goes on year round in Congress, and it takes, as you've probably noticed just by watching the news over the years, it takes them a long time to get around to passing appropriations, too long. But we do work on the provisions of the two acts themselves, requirements on USAID, criteria for prioritizing nations that are priority nations for water, sanitation, and hygiene work with USAID. We work with the agency a lot on this. Part of our job is to work with and support the agency, but another part of our job is to kind of help hold them to account. And we work with the Congress on monitoring the activity of the agency. So we are hoping that there will be hearings in 2021. Probably it'll be in the House. We're not sure. We're not sure at all that they'll happen. We're going to be working to get congressional hearings on how USAID handled WASH and other issues, other sectors in the COVID response in 2020, and also to review what the work has been under the Water for the Poor and Water for the World Acts, how the agency has met, or maybe in some ways still has some ways to go to meet the requirements of the law. So that's something else we work on. We also support more funding for the U.S. Centers for Disease Control and Prevention. We like working with CDC. We would like to do more with CDC. I think there are people in CDC who would like to do more with us, and an international WASH. And that's something we're going to try to be spending a little more effort on in 2021 as well. And we work with other international development sectors too. I mean, we don't just go to the Hill and talk about we need X dollars each year for WASH. Excuse me. We work with other organizations, many much larger than we are, to support the entire what's called the 150 account, the funding for U.S. foreign assistance, and all sectors. So we are always on the same line as the other organizations that advocate for foreign aid, and that works to our advantage for our own sector. And finally, we help our longtime House champion. Some of you may have heard of him or you met him over the years. He's been a real strong proponent of water and sanitation for a long time. Representative Earl Blumenauer, Democrat of Oregon, and his fellow House co-chairs of the brand new International Water and Sanitation Caucus, which was launched in September of 2020. We're helping them recruit more House members, and Republicans and Democrats. This is very key that it has to be bipartisan. The slide says 13 members. Well, we now have 14 members. We will get more in 2021, I am sure. Right now, it's equally divided, 7 Republicans and 7 Democrats. And for those of you not familiar with what a caucus is, just in quick form, a caucus is a voluntary organization that members of Congress who have an interest in a certain issue or area, they pull together to publicly state they are interested on an ongoing basis in this issue. They want to see some action done. It's completely voluntary. It does not have any control over legislation or what happens on the floor of the House of Representatives. It is not a committee or subcommittee. It doesn't approve or recommend specific legislation with any formal obligation. It's very bipartisan. It's just a collection of members of Congress who have a common interest. There are dozens and dozens and dozens, maybe hundreds, of caucuses in the House of Representatives and several in the Senate as well, around various issues. And this new one on water and sanitation is it's good for us because it will help to further institutionalize among members of Congress the fact that international water and sanitation is an important priority and needs to be paid attention to on a frequent basis. And we will be working with the caucus all through 2021 to get those hearings and to have various events on the Hill for members of Congress to build even more support for funding for water, sanitation, and hygiene. Excuse me. So last thing I just want to mention here, and I want to turn it over to Liz then. We are also involved on behalf of a number of organizations in the Global Sanitation and Water for All initiative. Some of you may be familiar with that. Sanitation and Water for All has been around, I think, for about 10 years now. It's composed of the governments of, I believe now, more than 40 countries, several donor nations, as well as many host countries, several multilateral organizations such as WHO and UNICEF as examples, a number of international NGOs and other institutions in the donor world and in the developing countries. MWA, just right now, or has for the last few years, served as the alternate representative, that's me, in Northern NGOs on the Global Steering Committee of SWA, or as we call it, SWA. I think the Europeans call it SWA. In America, we tend to call it SWA. So that's an ongoing thing, and we think in the next year there are going to be more things that SWA will do that will be of interest to organizations. And if you remember to go to that Google sheet that was mentioned by Dain at the beginning, we will try to occasionally send out some information on any developments of SWA that might be of interest to organizations here. And I think Chris, we can go to one more last slide, an oldie but goodie. Those of you who were with us last year saw this one. Maybe you can see it better now that's on a computer screen. I'm sorry, I can't help myself. I just like this one. Is the toilet paper. I mean, that's as close to a priority as it's got. So anyway, it's an oldie but goodie. And with that, I want to turn it over to, I believe, Liz, correct?
Yeah, thanks for that. John asked that I kind of dig in a little bit about what we're doing on the fiscal years and kind of regular funding process for WASH. My previous slides focused on emergency funding and what's urgently needed for WASH as part of COVID response. And as a reminder that emergency funding doesn't have any limits, but the regular funding process, the regular appropriations process does have statutory limits of how much money Congress can spend. And with that in mind, we are asking for a continuation of current levels of $450 million for global development WASH activities. You'll note that in the first slide, I gave a timeline of the fiscal year, and you'll note that we just started a fiscal year. We're actually in FY 2021 at the beginning of October. We do not have finalized FY 2021 bills. The government did not close. We did not have a government shutdown. And that is because Congress passed something called a continuing resolution, where they continue the current levels of funding from the previous year for a shortened period of time. So the government is actually only funded until December 10th at this point, and we expect, of course, additional action as we get closer to that date. But for the rest of the fiscal year, we are still advocating for kind of that regular funding level, and that's the $450 million. That $450 million request was developed. It takes a very long time to kind of develop these bills and write them. They're massive pieces of legislation, tens of thousands of pages long sometimes. And that went in actually before COVID even arrived. And that is part of the reason why we're focused so much on the supplemental emergency funding in addition to this regular ask, because the needs are so urgent. Looking forward into what seems like a mythical year, which will be fiscal year 2022, which will start in the fall of 2021 calendar year. Because we will have COVID, because COVID is largely here to stay, we're likely going to be looking at a higher number just to meet the basic development needs around WASH infrastructure, behavior change, and capacity building. I wanted to end because I think it's really hard. I've been working on the federal budget and international affairs budget for a really long time, and it seems it's very dry, and you got me there. But it does have tremendous impacts because when the United States increases its funding into these critical development accounts, including WASH, it does translate to increased reach around the world through USAID partners, through the Millennium Challenge Corporation and their partners, and governments that they work with, and through the State Department. And so, I think very early on in this conversation, John showed a slide that showed from FY 18, so 2018 to 2020, there was a $50 million increase in international WASH funding from Congress. And that translated to about 467,000 people being reached with both clean water and sanitation for an entire year. Those people would not have been reached otherwise if we had not secured that higher level of funding. And I put that up there just to share that while we're talking about dollars and it can be quite abstract, the reality is that these dollars directly impact communities in need around the world and can be a frontline response point and early warning system even for future pandemics. So I think with that, I'm going to hand it back over. I think, Chris, is it up to you, or do we want to wrap?
Well, thank you. Yeah, we can move into the question and answer portion of the session for today. We appreciate John, Liz, and Christopher's comments today. One area that's been a couple of people have asked questions on, and I think is probably a very applicable one, is how do we see the election coming up? And how does that going to change the dynamic in negotiations, regardless, if Trump wins, Biden wins, House stays, Senate flips, everything's a delicate balancing act right now. So how do we see things changing moving forward, or what's the dynamic that you're anticipating? A question for anybody.
I'll start, and my co-panelists may disagree with me, of course. Or not, of course, they might if they dare. I think it won't make a great deal of difference in one sense. Actually, Republicans and Democrats on this issue have been, yeah, as we've discussed before, this has been a very bipartisan issue for so many, many years, and that's been key to its success. It's also something that the Democrats who are sponsors of this, Senator Durbin, who's the deputy minority leader in the House, or in the Senate rather, who's our big champion for WASH in the Senate, and Congressman Blumenauer I mentioned before, who's our big champion, longtime champion for WASH in the House. They're very conscious about always making sure that Republicans are involved, not just as an add-on, but from the very beginning, all the way through the process. And I think they want to keep it that way. So if the majority in the Senate flips to Republicans, I think what it means, it's going to be a little easier to get foreign assistance appropriations done, because there are amendments that are floated each year on the floor, and they could still happen possibly from certain senators, like Rand Paul of Kentucky, who always wants to get a cut, and he always gets a few votes, but not very many, Republican and Democrat. So if the Democrats take the majority of the House, that makes it easier for them to run the schedule, and more importantly, in the committees. We've been lucky that, again, that the chairman, the Republican chairman of the when they've had the control of the House, and now that they still have control of the Senate, the Republicans who chair the appropriations committees are very supportive of WASH as well. So it won't make a huge difference. I think it will make it a little easier for us to get things done. I think it will help a little bit, and if the Democrats are in total control of the Congress, that is the House and the Senate, it might make things a little easier in terms of working, getting hearings and going through issues that we're dealing with, as Liz has outlined on USAID's response and what they have to deal with. Personally, I think it will make it easier on USAID itself, although the people at USAID couldn't say that, to have a Democratic administration. I don't see a massive change in terms of WASH prioritization right off the bat for either reason. Maybe Liz or Chris have something else to add or change, correct on that.
So just to quickly, I mean, I agree with John. I think in some aspects it becomes easier in the sense that, you know, with this current administration, we've been fighting out with the zeroing out of a lot of accounts. And so the discussion, you know, you have to go in first off and say why these accounts shouldn't be zeroed out, and then you know, to argue, and then go on to argue for an increase. So I think it kind of removes that first barrier. However, I also think that particularly if you have a shift in the, you know, the presidency party, the change of party and presidency, and then also potentially with the Senate, it becomes one of competing priorities. You know, I would anticipate, should the Senate flip, you know, we probably won't see a stimulus package until after, you know, a Biden presidency begins. And infrastructure will certainly be on that plate, which will be a good thing for, you know, what, like US domestic WASH to some extent. But I also think that there'll be a lot of competing priorities, and it'll be making sure that you get a seat at that table.
Yeah, and just to jump in really quickly, I agree with that, Chris. Even if the election changes everything and we see massive flips, we still have the current Congress and the current president for the rest of this calendar year until January. And so what you're going to see after next week is likely jockeying among the political parties to either try to stall packages or shove packages through while they see what they perceive to be as an advantage in their numbers. The election will change things. For one, it will be a brand new Congress. We've had a number of retirees this year, of critical members who are leaders on our issues, both House and Senate. And we will have to also kind of start from ground zero in terms of the new members of Congress and educating them about WASH. I think that there's a tremendous amount of work ahead of the new Congress, even if we get something later in the year to address the urgency of COVID. There will still be a lot of work left to do. And that is daunting for any administration, whether it's a continuing administration or a new one. And I always warn people to not discount the fact that, you know, if there's a flip in administration, there's a transition period, and that takes time. And you may not see things move as quickly as you expected, or had hoped for, that's normal to an extent. So I view the election in short to say that it's the beginning of a very long process. And as more information becomes available and the political parties see where the results have landed, you will start to see some of that shifting and messaging and jockeying around what they will or won't support, depending upon what they see as most advantageous.
Great, I appreciate that.
Dain,
Yeah.
just to go in a couple of quick sentences before we move on to another question. On that point, I just say, it is true, even though this is a very bipartisan issue, it is true that it's a little easier for us to round up in the House and Senate Democrats to get on a letter asking for more funding each year. That's just the way it is. Republicans tend to be a little more reluctant to do that. So Democrats tend to do that. But people should be aware that from the outside, that a Democratic administration doesn't just necessarily, even if a lot of the Democrats tend to be very sympathetic with foreign assistance more than you will find in among some parts of the Republican Party. At the same time, that does not automatically translate into increases looking ahead for foreign aid, because they have huge domestic spending pressures as well. And we saw that when the supplemental bills, the attempts that Liz and Chris and others of us were working on, where the Democrats were, Speaker Pelosi and others were producing bills or proposals in the House which is controlled by the Democrats, for funding, and leaving out international affairs altogether throughout the summer, or giving it less than we would want. So they have a lot of domestic constituencies that are also pressing for those same dollars. So it's not a cakewalk by any means, even though we have a lot of friends among the Democrats in the House and Senate, and we'll have presumably after this election maybe even more. But it doesn't always translate into total support for foreign assistance.
Thanks, guys. And one point I think is good to raise, and I think many people may not know on this call, but last year, we put on a briefing on Capitol Hill of many organizations here where they announced the Global Water Coordinator, the USAID Global Water Coordinator, which was done under a Republican administration, and then you're also going to see a lot of push from the Democrats. So I think it's not necessarily good or bad, like our panelists have said, but possibly just a different strategy in how to get there. Another question we have is, what are the most urgent needs or program opportunities related to WASH that we all should be amplifying for potential emergency funding? And then secondly, how might we advocate for the supplemental funding to be spent for the greatest and fastest impact? So that two-part question for any panelist.
I'm happy to take that one. Sorry, my unmute button. You'd think I'd get better at this by this point in time, but here we are. Yeah, I'm happy to take a stab at that. I think, to be honest with you, the most urgent issue is that beyond some of the advocates that you see on your screen today, not too many people are going up to the Hill and talking about the importance of global WASH, and the importance, frankly, of global WASH, and not just saving lives around the world and as prevention, but also keeping COVID from re-entering the United States should we get to a point where the outbreak is under control here. So one would be your voice. That would be the first piece. Amplifying the importance of this would be the biggest component. In terms of the programming component, there are tremendous gaps that we're seeing. Everything from solvency and utility providers because they're not receiving payments. Kenya in particular has had significant issues with that. Ghana, where they're running on perhaps maybe 30% of their normal income, and they are facing insolvency to where utilities are provided, all the way up towards more, let's be quite honest, permanent WASH services, and that includes sanitation facilities within healthcare facilities. Sanitation is usually something that is glossed over in healthcare facilities, but it's not unusual where, particularly in rural areas, where you'll see something like one, primitive kind of level of toilet of varying degrees. Sometimes it's a more advanced pit latrine, sometimes it's not, for something like 110 patients and the staff. That is going to be a disease vector space. Same thing in terms of transportation hubs. The other thing that I think is often overlooked for the WASH sector in terms of COVID is the role that WASH can and should be playing in economic revitalization and in terms of economic recovery. WASH is also a job maker. It is a chance to, as some say, build back better. But there's also a facilitation component towards overall economic activity in WASH. You need to have the ability to wash your hands at work. So some of the statistics that we found when we did our survey that Chris shared, a lot of them were around not having access in the workplace to wash their hands for Americans. And that is true across the world. So there are a number of areas in which WASH needs to be included. But I'll be very clear, it's magnifying that message. It is not something that members of Congress are necessarily hearing.
Yeah, because I mean, I'll just quickly add on just one quick to what Liz was saying. I think there needs to be even a step back and address it from a broader issue of, hey, WASH just needs to be prioritized in any sort of finance, any sort of aid that comes through the stimulus. We were participating in a program where all of a sudden, half the funding that was supposed to go to WASH interventions then got repurposed towards ventilators. Now, both are noble causes and noble, efforts, don't get me wrong, but, we advocate more on our side that an ounce of prevention is worth a pound of cure. And I think there's been a little bit of disconnect about the important role that WASH plays in the prevention and the spread of COVID. And it's even kind of advocating that basic message back to Congress so that it gets then into the programming at USAID, through Congress's directions to them.
I'll just say one quick word about that. I'll go step a little further than Chris and say that it was a distortion of what should have happened, quite frankly, that so much attention, so much investment was made in ventilators, putting that up front instead of dealing more with a lot of strategies for real prevention work where it's really more needed, and WASH is, of course, part of that. And the reason that happened, I think, is political. From the White House, and has to do with relationships between the occupant of the White House and some other leaders of certain countries. And that's one of the reasons, maybe not the only reason, that so much emphasis went to ventilators so early in that first round, the only real round, unfortunately, of emergency supplemental funding for international affairs.
Thank you. So we have about 2 more minutes, so maybe we can finish off with one more question. And again, remind everybody to fill out the Google form or reach out separately so we can answer any other further questions. One question is, we've talked a lot about USAID, but what are some of the other international funders for WASH outside, either private or public, from here or other countries?
I don't have the numbers in front of me, but there are the major donor nations. Those of us who work with these organizations and have field operations, such as my organization, Millennium Water Alliance, and our members, and WaterAid and others. We work very much with the aid agencies of the other countries that do the same work. The Dutch, the Germans, the British, Canada, several others. So they have some of the same issues. A lot of them have faced, for a variety of domestic political pressures the last few years, some serious cuts. There's been a big reorganization, as I understand it, in Britain of foreign aid. A lot of people there are not happy about that. So a lot of other countries do that. I'm not sure if the questioner is asking, Dain, maybe I'm missing part of it, is asking if these other countries are working with USAID in some kind of coordinated way, or is the question more about is there advocacy going on in those countries as well, which there is, of course.
Yeah, it was just saying, what other funders are there? We talked a lot about USAID, but what other kind of big partners or funders globally are there?
I'll just say one thing very quickly about the US. I mean, MCC, which Chris, I think, mentioned in passing at one point, the Millennium Challenge Corporation, they are set up to do a different kind of assistance relationship with selected countries. And they include water and sanitation in our portfolio for a lot of the countries that are called compact countries. They include that too. So there's that. US government funding for water, sanitation, and hygiene finds its way into other countries in different ways, not just through USAID. I just want to make that point. Chris, Liz, anything else?
Yeah, I would say, as you alluded to, John, the donor countries are a definite role. The donor countries, let's be very clear, also include Japan is a major investment point in WASH, and the European Union as well. But there are other actors in the WASH space, and I would encourage folks to start thinking more broadly about that. I think one is the low-hanging fruit would be, of course, family foundations or foundations that are responding. WaterAid is working with a number of foundations, including One Drop and the Bill and Melinda Gates Foundation around WASH, both in terms of long-term capabilities, but also in terms of response to this particular crisis. So there is that funding out there. And then finally, there is a significant space for public-private partnership and or for-profit partnership opportunities. I think one partnership that WaterAid has that we're particularly proud of is a partnership with Unilever, who actually stepped in and helped fill some significant supply chain gaps that we were facing around acquisition for just soap, whether it was for our staff or for the communities that we serve, particularly focusing on healthcare facilities. And so it doesn't necessarily have to be just funding. I want to make that very clear. There can be synergy around what value add can look like. And that's, to be very frank, that is why IAPMO is here. And Chris has been such a great partner in that space. Everything from providing guidance on what standardization there should be for when WASH is implemented, down to even working with some trade associations. So the partnership piece and the resource piece can be quite broad.
I know our time is out. I would just encourage you, as my parting words, there is a role for each of you to play, who are still listening. And I would encourage you to get involved. And the number one way to get involved is by, going to that Google form, links provided in the chat, where, we can keep you involved of, actions that you can take and, keep Lisa up to date with what's going on in the process. So then you can choose whether to, weigh in or not.
Yes, I want to thank everyone for participating today. We're out of time, and I know people are starting to depart the meeting for their next session. So again, feel free to fill out the Google form, keep in contact. Thank you to Liz, John, and Christopher, and also UNC for this great event, and Aaron for putting this on again. It's always been a popular and worthwhile event at this conference. So thank you again, and we'll see you guys soon.
Thank you, Dain.
Thank you.